Starting healthy this morning, babies who snore may end up being hyperactive by the time they're in second grade.
It sounds kind of cute, but these child sleep disorders are the focus of a study in this week's Journal of Pediatrics. So we've asked Dr. Diane McAllister to join us today to discuss this, because this happens to a lot of people. Of course, Dr. Diane is the Chief Medical Officer at Centura's Porter Adventist Hospital. So how did researchers conduct this study? Did they just get a bunch of kids and observe how they slept?
Well, they took 11,000 children and they had the parents fill out questionnaires about the children's sleep habits, looking specifically at did they mouth breathe, did they have periods of time where they didn't breathe, or did they snore? And then as they went along, they also did a behavioral standardized test looking for signs of behavioral disorders, and they took all this data and put it together.
Wow. And what did they find? What were the revelations?
Well, you know, the results were actually pretty stunning. Children who have disordered sleeping, so those things we mentioned, are 40 to 100% more likely to have behavioral problems as they grow older than children who have normal sleeping patterns.
So what about these breathing issues? I mean, what, you know, they may lead to some of this. What are the things we're talking about here?
So we're talking about apnea, which is periods of time where you normally breathe in a regular pattern and you kind of stop for a while. Also snoring, and then mouth breathing. And there's many reasons for that. But
are we sure that the breathing is what triggers these behavioral problems? Might it be something else entirely?
Well, you know, that's certainly a great question, but the researchers did a very good job of excluding other things like premature birth, low birth weight, mothers smoking or drinking during pregnancy, and they factored all those other things that we know cause behavioral issues out, and then they still had very statistically significant results.
So we have a parent out there that has a little one who's kind of having a tough time breathing. It's dry here in Colorado.
It is.
Right.
What can they do?
Well, the first thing, they should trust themselves. They correlated the parents' results with actual sleep studies, and they correlated perfectly. And then if your child is having those symptoms, you should go to your pediatrician and find out what the next step should be.
So what are some of those treatment options? Can you list a few of them for us?
Well, as in adult sleep apnea, if you have a child that's overweight, losing weight can help disordered breathing. And then tonsils and adenoids are a big cause of disordered sleeping in small children. So actually removing them opens up the airway and allows them to breathe more normally.
And you've talked to many a parent. Once they, you know, remedy some of these sleep disorders, they notice a difference in their child, don't they?
Yes, they do. And if you think about it, we all get cranky and have trouble paying attention when we haven't had enough sleep. So just like us, those little guys need their sleep so they can be alert and well-behaved.
There you go.
It all adds up. Thank you so much, Dr. Diane McAllister. And if there's a topic you want to see discussed here, email 11am@thedenverchannel.com. Dr. McAllister joins us every Wednesday, and you can find her weekly advice on thedenverchannel.com. Click on Staying